when you look at nursing questions on tests, so how many of you have already had fundamentals? We used to recommend that people would take fundamentals either with this class or before this class. So if they had a choice. We don't do that to people anymore because people need some of that flexibility. But there's a debate. Okay. So some nursing questions will be asking you about the nursing process, right? Okay. Always apple pie or add pie, however you remember it. It's that assessment, analysis, or nursing diagnosis. Plan, intervene, and evaluate. We have you use this process too in your clinicals because it's a good learning tool. We have you use the nursing diagnosis because it's a good learning tool. Don't spend your time memorizing nursing diagnoses, okay? Because they won't be on the NCLEX. They won't very often be in the workplace unless you're an MDS nurse, okay? But they are starting to show themselves. Now that they took it off the NCLEX, they're starting to show themselves back into the workplace. So just be aware, nursing does that. We go back and forth. So what's old is new, what's new is old, and we go back and forth between things. So just be really adaptive and ready for change. If you haven't already noticed in your nursing in nursing school, a lot of the sites change, and if one site changes, it changes all our instructors and where they're supposed to be at, and then all of a sudden there's a change in the schedule for like half the school, and that's how nursing works. There's constant change. It's constantly adapting. It's constantly changing. Technology is changing. So we've just got to be these people that can do that. Okay, we've got to be. So that's just kind of part of the job. A lot of times when they're wondering what do you do next, they're asking for what do you do next in the nursing process. Okay, if there's ever a change in a patient status, what do you do next? It's that assessment, right? If they haven't told you you've already assessed the patient, it's that assessment. Okay. Also, some questions will look at if you know the difference between an assessment and an intervention. Okay. So if the question is asking you, the patient has received an opioid and their level of consciousness has decreased, what do you assess first? Well, you already know that level of consciousness has decreased, but you've walked into the room. What's the first thing you're going to assess? Respirations, yeah. Respirations and SATs, right? But they didn't ask what your intervention was going to be. Had they asked what your intervention was going to be for a person with low respirations, then what would you do? You're going to go ahead and ventilate, right? If they're low, you're going to grab the ambu bag and you're going to start assisting their breathing, right? So make sure you're watching that so you know that difference between the assessment and the intervention. Okay, sometimes our interventions are education, and if they're looking for education, what would you educate a mother on for a seizure med that causes gingivitis? What would you educate a mother on for that? Good oral care, good flossing, brush for 2 minutes, use a soft bristle brush, those kinds of things. That's actually the nursing intervention there, okay? The nursing intervention is not that we would manipulate something with the order. That's part of the physician's job. That's not our scope of practice. an intervention is never for a nurse to give the patient a prescription that would be just for a month so that they have to return after a month. That's a physician's scope of practice. So I'm really glad to have these, even though they're going to take a long time to grade, I'm really glad to have these discussions that we're having online, because I'm really picking up on some